everyone. Today I will explain this figure. So this is the schematic diagram of the upper and lower motor neuron lesion of the facial nerve. Here you can see these are the upper motor neuron, and this black color mark signs are lower motor neuron. This is we can see this is cerebral cortex. And now we know that upper motor neuron comes from the cerebral cortex and synapse with the opposite side lower motor neuron and then supply the opposite side of the face. Most of the time are this upper motor neuron synapse with the opposite side lower motor neuron and supply the upper and lower part of the face, and but few number of upper motor neuron synapse with the same sided lower motor neuron and supply the same side upper part of the same side part of the face. And we can see, if we cut this upper motor neuron, what will be happened? We will see that the opposite side part of the body, part of the face, the lower part of the face will be paralyzed. But this upper part of the face won't be paralyzed because I have told you that a few number of upper motor neuron synapse with the same sided lower motor neuron and supply the same sided part of the face, and it is the upper part of the face. So you will see the lesion of the lower part of the face, and upper part you won't be affected and opposite part won't be affected. Because I have cut this part of the upper motor neuron, of course the opposite part will be affected, but this lower part of the face, you can see this angle of the mouth has dropped below because all this part of the muscle has been paralyzed. Next, if we cut the totally lower motor neuron, what will we notice? If we cut this lower motor neuron, we will notice that the same-sided part of the face, both the upper and lower part of the face will be paralyzed. What will we notice in here? Look, the drop down of the eyelid. Okay, drop down of the eyelid, the drop down of the angle of the mouth, or what will we see in here? If the lower motor neuron lesion occur, all the muscle will be affected, and this all affected side will be paralyzed. You can see the lower eyelid will drop here. The lower eyelid will drop. Yes, it dropped. Then the angle of the mouth will sag. Angle of the mouth becomes slacked in here. The face, and then tears will flow over the lower eyelid and the saliva will dribble from the corner of the mouth, and the patient will be unable to close the eye, will be unable to expose the teeth fully on the affected side. In this affected side, this person won't be able to close its eye and open his teeth because of the paralysis of this affected side. So that's all.